Okay, welcome back to Therapy Thursdays. It's been years and years. I'm Letty Garza, and this is the Epic Consulting platform, and I'm partnering with the Child Guidance Clinic, the Henrietta Weill Memorial Child Guidance Clinic, the Delano office, and I have Veronica Herrera is going to come on and talk to us about mental health and anxiety specifically. So here we go. Welcome.
Hi, thanks for having
It's good to
me.
have you.
My name is Veronica Herrera. I am a marriage and family therapist at Child Guidance Clinic. I have been for almost 3 years now. And yeah, I'm actually from Delano, so I'm really glad to be back working and serving my community.
Awesome. What made you choose this line of work?
Well, I took my first psychology class in high school. Shout out Mr. Watson. And I was really interested in it. And I also just always have had like a desire to help others. And I feel like combining my interest of wanting to help others and, psychology, it led me here. Actually didn't know that I wanted to work with children initially until I started working with adults in my my internship, and I was like, wow, if we had started working with these adults when they were younger, like, it would have been really helpful. So like I'm really glad to be working with the population that I do now.
Awesome. Yeah, it takes I think people realize that too when they go into teaching, probably. Who's
True.
the best group? Okay, now we're going to focus on anxiety. Can you share a little bit why that was the topic that you wanted to do?
Well, as we'll see in the stats, it's actually the most common mental health disorder in the United States right now, according to some research done in 2022. And I think a lot of people maybe have an idea of what anxiety is, but maybe don't know when it gets to the point where it's more debilitating and it impacts their lives more. I think it's a great topic to start off, is Mental Health Awareness Month with. Yeah.
Okay. Awesome. Let me pull up some slides and we can start the conversation. Okay. All right. So let's share your stats here.
Yeah. So like I shared, it is the most common and it affects 40 million adults, ages 18 and older, but definitely seeing, with the population that I work with kids and teens, probably as young as, like 5 or 6, where we start to see those signs of anxiety. And even though it is very highly treatable, there's a lot of very effective treatments. Less than 40% of people will, not receive services for that or receive treatment for it. We'll also talk a little bit more about, some of those barriers to treatment. Also, because as we'll see, a lot of the effects that anxiety has on our bodies, people who experience anxiety are also 3 to 5 times more likely to go to the doctor for their symptoms, and even to the point where maybe they have to be hospitalized for the symptoms. We'll go into talking a little bit more about what that looks like.
Mm-hmm. Okay.
So it's good to know what anxiety is to start off with. So really what it is just our body's reaction to a perceived threat, to something that seems like it could be a dangerous situation, which is very necessary. It's important that we have anxiety, and it does keep us safe. So it tells us that, there's something here that could pose some sort of threat, get ready for it. The issue though becomes when something harmless like presenting or taking a test starts to feel as dangerous or as harmful as like, you know, being in the first thing that comes to mind is like a tub full of snakes. It starts to feel equal, and so you know people start to maybe avoid situations or that make them feel anxious, or they might start to experience more of a debilitating level of anxiety. So how to tell when it's like helpful anxiety versus more of a disordered anxiety would be if it starts to become excessive. So if it's the level of anxiety that someone is experiencing isn't equivalent to the threat. Um, if it's happening very frequently, so it's happening more often than not, more days than not. If it's very difficult to control, so despite their best efforts at trying to manage their anxiety, they're not finding things that are helpful, or maybe just not um, it's not doing the job. And then also if it's impairing their social functioning, whether that's like they're withdrawing more from people, um, if they're not performing the same in their jobs or at school, those are usually the telltale signs that, it's starting to get to that point where it's more debilitating, more disordered. Mm-hmm. And
Okay, so I'm
go
gonna. Oh, go
ahead.
ahead.
I was just going to say that going back to like it being necessary, when our body is reacting to the anxiety, it can be like it's important for us to understand how our body experiences anxiety. So we'll go over like the different symptoms, but like for example, if our body is sweating, it's getting ready to exercise. So if I'm seeing that something is going to be dangerous here, I need to get out of here. Let me get ready to run. Um, also if our mind's kind of going blank, and it's hard for us to think about a situation, anxiety turns off that part of our brain that helps us think more clearly, so that we just react in the situation. So again, it is a necessary part of the human experience. Just want to get it to where it's helping us out instead of hurting us.
So would this be a reason why when people are in, really super stressful situations, they don't really remember what happened or how they decided to do something?
Yeah, and if we can like see the positives in that, it's like in some ways like it's our body trying to protect us from, those memories that might be uncomfortable or might be distressing to us. But then it can also obviously create some bigger issues there too.
Okay.
Mhm. So some causes of anxiety could be genetic. So if somebody's parent or sibling had anxiety, then they may be more likely to develop an anxiety disorder. But that's not always the case. But if there's some of these other causes there that are present, then it could be more likely that they do present with anxiety. Um, also. The environmental factors that happen. So like if they're constantly exposed to stressors in their life, if they just have constant life events happening that trigger that anxiety, then their body starts to kind of just get used to responding in that way, and it creates more of that like constant anxiety response. Like that's just like our go-to response to situations, even if there isn't necessarily a actual threat. um, Also, there's like the physical causes. So for some people with anxiety, their brains just work differently. Like they have when it comes to like their amygdala, which is the part of our brain that helps us know that there even is a threat. It's just kind of overactive, where it's telling us that there's that constant threat even if there isn't. So it just kind of distorts our idea of what's dangerous and what isn't.
Mhm.
Um, then some risk factors. So yeah, if you see on here like chronic stress, somebody who's constantly under that different stressors in life, they're also more likely to develop anxiety. history of trauma. Also, like if we think about like somebody who grew up in, you know, an abusive home, and maybe in those situations, them um, running and hiding from things maybe helped keep them safe in that situation. But now, even hopefully when they're out of that situation, at some point, they might still have that same learned reaction to that actual threat at the time. Now, when there's no longer a threat, they continue to have that same anxious reaction. So, it's now not protecting them, and instead maybe it's hurting them. So yeah, these are all different risk factors, different personality types, like somebody who's more neurotic. So there's some good things to look out for.
Now, what are the ages of your clients normally, since you work at the child guidance clinic?
Yeah, usually I think the youngest I've ever worked with is maybe like 3 years old. Oldest that we can work with is like 21. Of course, when kids are younger, it's a lot of work with parents. So we definitely try to provide that overall support: individual services, family services. Collateral is just working with parents. Mhm.
So then how would you discuss some of these risk factors with, if whatever you're identifying with your child, the children that you're seeing, and then how do you normally, if you can talk about it, obviously without, you know, I don't want you to identify anyone, obviously, but parents, like how do parents react to some of these things?
Yeah, I think a lot of parents, they just want to know like why this happened, like why are they experiencing this, like how did, I think naturally, they just want answers, so that they know how to better support their kids. And I think it is helpful to know these causes and risk factors to let them know that, maybe it's not the answer that they always want, but it's like, there's a lot of reasons why this could have happened, and there's not one thing that's to blame. And it just kind of helps us understand, like, okay, like this could have been different things that led to it. I think it gives a little bit more of a peace of mind that um, that there's different factors that played into it. Mhm. And maybe for a lot of these can't be changed. So a lot of, depending on the modalities, they're more like focused on now what we're seeing, knowing that there's certain things in their past, or certain things about like their genetics that we can't change, for example.
Hmm. And then I guess also if there's more than one kid in a household, um, because I've heard a lot about, or I've had conversations where we say we grew up in the same house, but we didn't have the same parents, or we didn't have the same childhood.
Yeah, no, for sure. That's so real, because it's like they could have same parents, same household, but they still have, some, like, there's still differences in their DNA. When they are out of the home, they still have different experiences, like at school. They're still their own person. So they might, um, they might just be affected by things differently. They might have a different personality type. So it does kind of help to know, like, that there isn't just one way to explain that this person is definitely going to have anxiety. There's a lot of things that play into it.
Sure.
Mhm.
This is a big one.
Yeah, there's a lot here. So, and there is a lot, but really people are going to experience anxiety differently. So everybody's going to have their own. Something that I do really often with kids is have them just kind of do like an outline, or like have kind of like almost like a gingerbread person, that they can write their different symptoms that they're having, like in their head, throughout their body, so that they understand their own personal symptoms of anxiety. Um, but some of the most common ones that I would say I see is like having a hard time concentrating. Um, there was good to like the worst case scenario. Somebody with anxiety thinks that, it's like, well, what if this happens? And those what ifs are usually the worst case scenario that can happen. Even, so it is helpful to kind of think instead, like, well, what's most likely going to happen? Also, uncontrollable thoughts, overthinking, really common. When it comes to behavioral, a lot of restlessness, of fidgeting, um, withdrawing from people, especially, of course, with like social anxiety. Avoidance is a big one because, I think that we saw that a lot with COVID, where there's a lot of anxiety about coming back to school for a lot of kids, and whether that was like being around other people at school or just with social anxiety, a lot of things just play into it. But so they would avoid going to school. They felt better at home. It's just like, well, if I don't go to school, I don't feel anxious. But that avoidance just grows. It feeds that anxiety over time. It just doesn't get rid of it. Maybe presently in the moment it does, but doesn't get rid of it. Being more irritable. So I think that's one that I see a lot with teens or kids, where it just seems like, well, they just have a bad attitude, or they must just they're just an angry kid. But part of that could just be they're anxious, and that's how it presents. Have a more startled response, like they're more jumpy. They also tend, people with anxiety are more likely to try to self-medicate, because if we see all these symptoms, these are overwhelming. And so people try to find their own ways of trying to cope with this, especially if they're having difficulties accessing mental health, and, other things are more readily accessible, unfortunately. So that's another common symptom. When it comes to the physical, shortness of breath, having a hard time breathing. So definitely like learning to manage our breath is a big one that helps. Sleep difficulties like insomnia, having difficulty sleeping, we're overthinking, our thoughts are keeping us up. Eating more or less. GI symptoms is a lot of one that I see really commonly. That's actually really cultural too. Like I see it a lot with like the Hispanic population, like where they like we just have more like stomach issues when we're anxious, and so parents are taking their kids to the doctor, like their stomach's hurting, they're always having they're always feeling nauseous, or when they go to the bathroom, it's just it's just they're having issues in that area, and the doctor might not be able to find a physical explanation of it, and it might be a sign that there's like a more of a mental thing going on, like anxiety. Muscle tension, if we see like the restlessness, over time it creates a lot of tension. Same thing with headaches, pounding heart, shaking. So these are really common. It's important to know which ones that person experiences, because there's different ways of managing these.
Can you talk a little bit about, I know you mentioned the like the gingerbread and maybe identifying where in our body we're feeling things, but what are some other ways that it might be different um, to get kids to talk about how to identify anxiety in the first place, or the difference between feeling sick and having to go to the doctor, and what might be more like, how do they become more self-aware of that? I'm sure it takes a lot of time.
Yeah, well, sometimes when I have them like do the gingerbread person, I might have them try to describe like their triggers for these things, like if they can, kind of identify when does this happen. Um, you know, are there times where these don't happen? Also trying to focus on the positives. Like, are there any times where you do feel like more calm? There's a lot to learn from that too. I think with mental health and therapy in general, I think people think we just focus on when things are wrong, or like trying to fix the problem, but a lot of the times it's like learning from when things are going well. So like, when are the times that you feel most calm? What are some of the things that help you control some of these things? What works? Because I think kids know a lot of about what helps them too. So it's kind of not just me throwing interventions at them, it's like them also telling me what works for them.
Yeah, that's great, because as adults we have a hard time with that
Mhm,
too.
for sure. Yeah, so types of anxiety. So the first one is generalized anxiety disorder. So that's um, one of like the most common. That's just more of like a kind of like it sounds, somebody who is more anxious in various situations, not anything very specific. And that's when it gets to the point where it's like more uncontrollable, excessive, constant worrying. When it comes to specific phobias, they're more like um, irrational fears about something that in reality doesn't really pose much of a threat or danger, but it feels, you know, it feels really scary. Like even if they might not come across this situation, just like the fear of that thing, um, they just develop that phobia to it. Panic disorder is another one that is really common. A lot of people like go to the hospital because they think that they're actually like having a heart attack or that they're dying. And, they get everything checked out and they see, no, you're fine. But, that's usually a lot of the times when people find out that they actually have anxiety or panic disorder. And actually, panic disorder and another phobia are also really reoccur or co-occur. A lot of times it's agoraphobia, where people then start to have a fear that they're going to have a panic attack, and that they're going to be in a situation where they might get embarrassed, or they're not going to be able to like escape that situation because it's just like hard to escape. Like if they're in a big crowd or like in the middle of nowhere. So that's two really common ones that go together. Just going back a little to the phobias too. The common ones might be like to animals, or like other living creatures, like dogs. Maybe somebody had like a bad experience with a dog in childhood, and now they have a fear of dogs, or like injury or blood. So people like maybe have a phobia of getting their blood drawn or getting shots. So, and in some ways, like again, these make some sense, like if a dog posed a threat at the time, but if it's like one of those little fluffy white dogs with the crusty eyes, like those don't really pose much of a threat, but they feel as scary as they did in childhood.
That's really interesting. I had a conversation with friends of mine over the weekend because we were talking about something similar. I'm afraid of heights, and so we were talking about like what triggers these things. Like what I never experienced anything that would like somehow put that my adjust my brain chemistry in such a way, because they are my friends are twins, and they both have a fear, like a phobia of like uh cold water or drowning, and they said they never experienced anything like that as kids, and so they're not sure like where they were like maybe it was like in another life, like something
Yeah.
happened and there was just like this there's some trigger for them, like they hate swimming in a pool and they don't like being in the ocean. But there's like this fear, a specific like drowning in cold water fear.
Yeah.
I just think our brains are so amazing. It's interesting.
No, yeah. And even like with the fear of like heights, I think for that one, it's like, it makes sense why like being up high, would like feel like a dangerous situation. So it is adapted to have like some level of fear or caution, I would say, like with that. But for some people who have like very severe fear of heights, even just like being on a ladder or like on a step stool can,
Mhm.
make them feel very anxious. So that's when it comes to the point where it's maybe more distressing or more of an issue.
Right. Okay. Treatment.
So here's some of the common ways of treating anxiety. So the first one there, CBT, which is actually one that I use pretty often. Um, it's kind of understanding the connection between our thoughts, feelings, and behaviors. So the way that we think affects the way that we feel, affects the way that we act in situations. If I think that, if I don't do well on this test, I'm a failure. I'm going to start to feel anxious in this situation, and my brain's going to kind of turn off, and I'm not going to really be able to think in this situation where I really need to be able to think. So I'm going to take a test. Um, so and it doesn't always work in that way, like where it's like we just have to learn how to control our thoughts, but that is a big part of CBT, learning how to reframe our thoughts, making our thoughts be more helpful to us. instead in that situation, maybe thinking like, I can do my best on the test. And, that might make me feel a little bit more encouraged, might make me more likely to study, might make me more likely to, stay calm and be able to focus on the test. Also, it can go at different points of it, or you can tap into like either part of this, like with your behaviors. You can learn to control your breathing. That makes your body think, okay, my breathing is controlled. I must be safe. I feel safe, So we can kind of tackle it at different points here. Also, exposure therapy. So with exposure therapy, that one works really well with like specific phobias. So I see a picture here of a spider on somebody. So that would probably be like towards the end of therapy. We might start off, because for some people, even just like this image of a spider would be too much. So maybe starting there, and then maybe having a spider in the same building, and then in the same room, and then like on your lap, and then maybe we get to the shoulder, kind of just like easing into it and seeing like that slowly over time, being exposed to something like that, we see that it's not so bad, or the anxiety starts to dissipate over time. Relaxation skills are a big one for sure. So that could be like I mentioned earlier, learning how to control our breathing. A big one that I like to do too is progressive muscle relaxation. It's just like a full body, tension and tensing and releasing of our muscles in our body. I'll usually tell kids to watch a video that guides them through it. It's like on Therapist Aid, like how to do progressive muscle relaxation. So as they're learning how to do it, there's somebody there also guiding them that they can keep practicing when they need it. It actually helps with sleep a lot too. And like I mentioned earlier, with anxiety, a lot of people have issues with sleeping. So it's another good one. Another helpful thing is like just being present, being able to ground yourself. I do that a lot with like people's five senses. So it might be like the five senses grounding exercise, like let me look around the room, see like 5 things that I see, 4 things that I feel, 3 things that I hear, 2 things that I smell, 1 thing I taste. Or it could even be like almost like having like a little toolkit with all those things. Like, what are the things that I can look at that make me feel calm? It might be like, I heard of people using like, they'll have like their screensaver as like the universe to kind of remind them like, things don't matter too much. Like, it's okay if I mess up on this one thing, the world will go on. Or like, whatever is calming to them. This is really like very individual and like what works for them. Listening to music that, is calming to them. So it's really just learning from them what works. Then with medication, there's different types, and I'm not a doctor, so I can't speak too much to it, but, some common ones are like SSRIs. I don't think I had mentioned it, but one of the physical causes of anxiety too was like if people's like dopamine levels are off, or like different neurotransmitters are, there's a chemical imbalance there. So SSRIs are common ones that are used to try to, create more of a balance there. So Lexapro, Prozac, and Zoloft are some really common ones. Then there's also like benzodiazepines, like Ativan or Ativan, Xanax, and Valium. Those are some other common ones, or other types of antidepressants. So I know there's a lot of information there.
Okay.
Yeah, and so now some barriers. So, which is, I think, why I really like that we're doing this, because I think this kind of breaks down a lot of those. I think the slide changed there. It kind of breaks down a lot of these things that hopefully could make people more likely to access services, by having months like Mental Health Awareness Month or podcasts like this. So stigma is a big one. People just like having that fear of, what will people think about me if I'm in therapy or if I have anxiety. I think unfortunately, there are a lot of prejudices against, or people have, negative ideas about people who have some sort of mental illness or, um, you know, especially culturally, like if people might just think like, you're crazy if you have, anxiety or, um, just there's just a lot of negative associations when it comes to mental illness. So I think things like this really break down that stigma. Also, lack of accessibility. I mentioned, we're here in Delano, and unfortunately, there's not a ton of services or resources in the area, but I think we do a great job of trying to provide that research or sorry, trying to provide that those services, and we do a lot of outreach to try to let the community know that we're here. And we work a lot with the schools, and we actually, like, if they have lack of access to like transportation, a lot of times we'll also meet them in their homes or at schools. So things like that organizations can do, like, I think really helps people receive those services. um, Having concerns about confidentiality. I think the cool thing about therapy is that, for the most part, that if you tell this person, your therapist, what you're going through, like, it's something that stays there, whereas like if you tell your Thea, she might tell everyone sometimes. And
Yeah.
no, there's some good Theas out there. If my Thea's watching, that's it's not personal.
Not you. We're not talking about you.
Yeah. Also, like finances or lack of insurance. We serve the population who has access to Medi-Cal. So I think it's important that we have more affordable options for therapy. A lot of places also provide like sliding scales. Um, but that's a big reason why people might not have access to services. And then also lack of awareness. They might not know that what they're feeling even is, part of their mental health. They might not know what mental health is. So again, just love that we're doing things like this to try to bring that awareness to people.
Yeah, that education, and I feel like, or I believe that here locally, the school districts seem to be pretty responsive. I mean, I
Mm-hmm.
don't know. I'm guessing because it seems like you guys are really busy at the clinic there. Um,
Yeah, no, and actually, it's great. A lot of the schools will refer their students to our services. That's, I think, a big portion of the clients that we have is like, getting those referrals from the schools. We'll do, like I mentioned, outreach events with the schools, letting them know, letting the kids know and the schools know, the types of services that we provide. Also, um, when I hear about like schools providing like social emotional learning classes, or they're incorporating those things. I think it's really cool. Even like some of the schools, I know they're doing a lot of like their own events right now for Mental Health Awareness Month, letting them know what services are out there. So I think it's getting better, thankfully, because of events like this.
I want to ask a couple questions before I pull up the resources page because you mentioned a little bit about a lack of awareness. So I'd already actually had this question ready to go. Like, how would you tell people then if you are doing an event where you're talking to parents maybe, but also when you have those clients, those that are students that are young, um, what are some of the ways, and maybe you've already touched on this a little bit, but how do you tell people like this might be a mental health issue and not just a physical issue?
Hmm. Yeah, and I think a lot of it has to do with just like having them let me know like what it is that they're experiencing, and then just kind of connecting and providing that psychoeducation about like these could be common symptoms of anxiety, and just learning more about the situations that they're experiencing this anxiety in, learning about maybe what are some of the things that they currently do to try to help them with it, seeing if those behaviors that they're doing, if they're adaptive or maladaptive. Like, for example, if somebody's, because a lot of disorders kind of tie into anxiety, so it's good to see like if they're like being able to, how do you say, differentiate if it's anxiety or if it might be something else. Like if they're having intrusive thoughts or unwanted thoughts, and they're actually now doing something like a compulsive behavior, then okay, being able to differentiate, like, okay, maybe that's not so much anxiety now, but maybe it's kind of leaning more towards like obsessive compulsive disorder. Just a lot of it's just we try to do very thorough assessments, like the initial appointment that we do with clients and their families to learn about, what are you experiencing, what symptoms are you experiencing, how long has this been going on, in what areas of your life is it affecting you, like, yeah, it's just a whole process.
Okay, and then the second part of that is, and you talked about it a little bit. Can you just maybe give a couple of different examples of what you would do to maybe help alleviate or treat anxiety in someone at one age, maybe like under 8 years old, and then maybe something for like a teenage. Some
Yeah.
examples of what that might look like.
Yeah. So for younger kids, if you see my books here, I'll try to use a lot of like social stories, or kind of maybe not putting so much of the pressure on them a lot of the times to like understand what they're going through, because again, they're still learning themselves. So just kind of like maybe a book about anxiety, and seeing how this plays out for this character in the story, and maybe asking them questions about it to see if they can relate to that. So for younger ones, that might be something that I do, or a lot of like I mentioned, the gingerbread exercise. That's not the only intervention I do. Like it sounds like that's the only one I do, but just having like more like art, more creative, ways of them talking about their feelings, even if they're not really fully ready to talk about it directly. As kids get older, I think sometimes it's hard even when they're older, like where they maybe still haven't had that opportunity to learn how to express their emotions. So even just like first starting, even with the kid, like older kids, like being able to put their feelings into words, and maybe giving them like an emotion wheel where they can start to expand on their emotions, where it's not just I feel good or bad. I'll usually be like, okay, well, it's not exactly an emotion. What kind of emotion does it feel like? Does it feel like a happy emotion, or like a sad emotion? And that kind of extends out to be like okay, it's actually like I feel like disappointed, not just sad. And so it looks different for different clients for sure. And it's just kind of even if it's not even just on their age, but even just like at their developmental level, being able to see what makes sense for them.
I love that you brought up that like emotion wheel. I've seen several versions of that. It looks like a color wheel, right?
Yeah, they're on
I
pillows
think
too.
it's good. Yeah, it's good for us to have just everybody to have that, because I think that a lot of times we don't know how to identify how we're actually feeling about something, and then using
Yeah.
the language, um, something specific that, and I've been telling everybody, I'm telling you now, and whoever's listening, the difference between saying, and I'm trying to do it myself, between saying I feel, um, and then not actually name a feeling after it. Like I
Mhm.
feel that, and then I'm sharing a thought instead of an actual feeling
Oh,
that I'm
yeah.
feeling. And
Mhm.
I know that I did, but as soon as I heard that, and I was probably like on TikTok or something, where somebody
Mhm.
identifying that, I'm like, oh my God, I do that. And so I never really share what I'm feeling, or tap into like my emotional state. It's always sort of analyzing the thought instead of the actual feeling. So it's just so important to like catch ourselves and then learn
Mhm.
what those, how to identify what we're actually thinking and feeling so we can communicate better.
Yeah, and it's so vulnerable to be able to like say like what it is that we're feeling. So maybe it makes it a little bit easier to like just like share what we're thinking instead. So yeah, that's a good way to catch yourself. Like instead of saying like, I feel like you're not listening. It's like I feel,
Right.
um, ignored, or I feel something like that. Yeah.
Yeah. And then, yeah, I mean, we're not going to do a therapy session right now, but
Yeah,
yes.
no, no, yeah.
I'm going to pull up the last slide that you shared with me.
Yeah, so
Talk
those are
about
just
what the,
references of where I got some of the information. But for in terms of like resources, we're here at the Child Guidance Clinic in Delano. like I mentioned, we serve children and adolescents, and serve their families also. We also have offices two in Bakersfield, and actually in Bakersfield we also have adult services on Roberts Lane. So yeah, we're here if anybody wants some services.
Yeah, and you know what? I did not have the website ready. Is it just? It's just the initials, right? It's .org, yeah. So that people can just check it out. It's a great website. Actually, it does really. It's all right. Okay. Yeah, so you can go there if you and ask at your local schools, because I know that they have information at the schools if they don't. But the website does have a lot of information on the different offices and services that are being offered, as well as the foundation where people can donate, because it is it's
we are a
county.
Mm-hmm.
Yes, and it's.
Mm-hmm.
Anything else you want to share before we step out?
I think I said a lot. I hope a lot of it makes sense.
No, it's perfect. It's a great way to start, because I think, especially where we are right in 2024, and I know I wanted to kind of do like a quick, for me, the chronic stress of everything that's happening in the world. I think about kids all the time. So I also am an educator, and I work with kids and with parents. So I don't want to ignore that, especially like my son too, when he was younger, he asked questions, he watched the news, his friends would bring stuff up, and it didn't matter what the topic was. They're not blind to it. We just don't talk enough to them at their, developmental stages to I feel like we don't think that we don't treat them like humans sometimes. They're just like, oh, those are kids. They don't need to talk about that. And so I want to make sure that we also like keep reminding everybody that we should be watching out for each other, but definitely for our kids, because that chronic stress is going to seep into their lives. And then the services are available as we get older.
For sure. And I know we were kind of chatting a little bit before about like some things that I feel like are helpful. It's really about like being able to, like, once you're able to identify what how your body is feeling, being able to identify your feelings, seeing what you need, like being able to meet your own needs, like if that means taking action, and that's what's going to help you manage some of that stress, or if maybe setting some boundaries and taking some time for self-care is what's going to help you. It's really about learning what works for you, what's going to help you.
Definitely. Well, thank you so much for kicking off the month. It's always hard to go first, so thank you for that. And I can't wait to see like what your colleagues, the next 3 Thursdays, everybody meet us here, Therapy Thursdays, 6 o'clock live. All right. Thanks, Veronica.
Bye,
everybody.